All right, Missy, let's start.
All right. Technically, it's 6:59, but I'll start reading the whole little spiel I got to do. So get this done and over with. As a preliminary matter, this is Missy Cackler Boisver, Senior Administrative Assistant to the Mendon Board of Health. Permit me to confirm that all members and persons anticipated on the agenda are present and can hear me. Alan,
Yes.
Tom,
Yes.
Andy's not coming tonight, and I don't expect anybody calling in or coming in because your agenda is very small. Good evening. This is the open meeting of the Mendon Board of Health to be conducted remotely consistent with Governor Baker's executive order of March 12, 2020, due to the current state of emergency in the Commonwealth due to the outbreak of the COVID-19 virus. In order to mitigate the transmission of the COVID-19 virus, we have been advised and directed by the Commonwealth to suspend public gatherings, and as such, the governor's order suspends the requirement of the open meeting law to have all meetings in a publicly accessible physical location. Further, all members of the public body are allowed and encouraged to participate remotely. The order, which you can find posted with the agenda materials for this meeting, allows public bodies to meet entirely remotely as long as reasonable public access is afforded to the public so that the public can follow along with the deliberations of the meeting. Ensuring public access does not ensure public participation unless the participation is required by law. This meeting will feature public comment. For this meeting, the Board of Health is convening by telephone conference / video conference via Microsoft Teams, as posted on the town's website, identifying how the public may join. Please note that this meeting is being recorded and that some attendees are participating by video conference. Accordingly, please be aware that all folks may be able to see you, and that take care not to screen share your computer. Anything that you broadcast may be captured by the recording. All supporting material have been provided to members of this body and are available on the town's website unless otherwise noted. The public is encouraged to follow along with the posted agenda unless the vice chair notes otherwise. We are now turning to the first item on the agenda. Before we do so, permit me to cover some ground rules for effective and clear conduct of business and ensure accurate meeting minutes. I will introduce each speaker to the agenda. After they conclude their remarks, the vice chair will go down the line of members, inviting each by name to provide any comment, questions, or motions. Please hold until your name is called. Further, please remember to mute your phone or computer when you are not speaking. Remember to speak clearly in a way that helps generate accurate meeting minutes. For any response, please wait until the vice chair yields the floor to you and state your name before speaking. If you wish to engage with other members, please do so through the vice chair, taking care to identify yourself. And with that, I would turn over to the agenda, which is the first thing is update of COVID-19. Alan?
Okay. I'm seeing everything flow about the same. It seems as though some people are right on task with what needs to be done to follow the guidelines, and then I see other situations where people look like they're getting a little too comfortable and might need an occasional reminder. It's hard, it's summertime, I understand, but for the most part, I would say everything I'm seeing and hearing is encouraging that we're continuing to proceed in the right direction. Tom, what do you got for us?
Well, no opening statement. We're rolling along with the reopening process. Aside from what I had run into a couple weeks ago when Missy, you were on vacay, a couple of small issues that were addressed. I haven't been around the town locally myself a lot the last couple of weeks since we last met. So I'm hopeful that everything is going well. I'll have to defer to our illustrious boots on the ground, Missy, to let us know if things are flowing well within the community. Back to you, Mr. Vice Chairman.
Thank you, Tom. I agree wholeheartedly. Missy, why don't you give us the official picture of how we're doing?
What's going on? Everything's going okay. Right now, the last count, we only have one active case in Mendon. Anne, good for her, is actually on vacation this week. So she does have someone covering for her. I haven't heard anything out of this person. So I'm just going to say right now we are at only one active case, which brings the total of what we have as 31. And I believe, according to the state website, I think we've had over 600 residents tested. So if we've had over 600, only, and I don't want to sound like it's little, but only 31 have come back positive. So I think that's not too bad for the size of town that we are. We are getting some complaints that come in. We have some that have gone to the state. The state has contacted me. I've sent Lenny out to go handle those issues. One of the issues we've had recently is a dance studio in town. I believe there's only one left. Parent is concerned because they are going to hold, she contacted me first. She was concerned because they were going to have a recital, and there was no bathroom facilities going to be available, no hand washing or hand sanitizer available, things of that nature. So I reached out to the two Mikes, Mike Coughlin and Mike Flanagan, I'm sorry. And they emailed me back and gave me what the procedure would be. So I emailed it to the parent. She later must have contacted the state because I told her we won't get involved unless there's a complaint. And apparently last night, this particular dance studio had over 20 kids in one room unmasked. They were younger kids, but I don't know they were young enough where they were not required to wear masks. Because if you remember, 2 and under were not required, but anything over that was. So she has contacted the state. The state has CC'd me on the email that I believe, sent out to the dance studio. So I'm just waiting to hear back. We did hear about another restaurant in town that they sent a resident, or a person, I should say, sent a complaint to the state. We had already gotten the email from the complaint. The person making the complaint, I already sent Lenny up there. Lenny went up there and took care of it, told him, we can't, this is our third time. If I have to come back up here again, we'll start the finding process. And they understood. And when he walked in, the person coming from behind had his mask around his neck. So he didn't have it on properly. And Lenny kind of scolded him and said, you know better. So we'll wait and see how that plays out. But yeah, right now I'm just kind of fielding complaints, trying to get people on track when they ask questions. I try to, if I'm not positive about the answer, I will contact the state just to make sure I'm on the right page as they are. So as of right now, that's pretty much off the top of my head of what I have for updates for you guys as far as COVID-19 is concerned. Alan?
Thank you, Missy. Very good. If that's all we have on COVID updates, we can move on to the next item on the agenda.
Just one question, if I may, before we move.
Yes, Tom, please.
So just out of curiosity, Missy, I know you had mentioned in general summary there, part of your summation was fielding complaints. Just to get an idea, what's it been from your perspective on a daily basis, what you are getting in terms of a quantity of complaint level, just so I can kind of get an idea in my head?
I wouldn't really say there are a lot. They might be follow-ups, like that one particular person with the recital. I might have gotten 3 or 4 emails from her. So, I mean, if you take it, how many individual responses I'm making even to the same person, it's a couple. But as far as, complaints for a particular one establishment, I'd say this week I've probably, for different things, I probably got, say 4 complaints. So I don't think it's really all that bad. But in those 4 complaints, I might have sent a follow-up email 2 or 3 times, just to let them know what I found out, and if I find out any more, if they come back with another question, that kind of thing.
Gotcha. Okay, very good. Thank you.
You're welcome. So Alan, the next thing we have is kind of related to COVID, but not. It's discussing the possibility of having a drive-through flu clinic. Again, a couple of weeks ago, Anne reached out to me. We had talked, and the idea has been floated around because she's not, so far, really hasn't got any solid guidance from the state as far as how flu clinics are supposed to be run this year. So the idea is that maybe this might be a good opportunity for us to start working with Jamie Terry from Region 2, working on our drive-through plan up at the school, and do the flu clinic as a drive-through, just in case, if we're responsible or play any part in giving any kind of vaccine for COVID-19, where we still want everybody to social distance and things like that, the drive-through might be the best way of doing it. So I just want to run it by you guys to see how you felt. Jamie is away this week, but she did send me an email saying she's more than happy to help us work it out. I don't know if we start off with meeting with Jamie first and seeing if Anne wants to come in and we start working on it kind of together, or do we pull Anne in and Jamie in and contact Dr. Maruschek and, the police department, however. So I wanted to run it by you guys. Alan?
I like the idea, and I like the idea kind of twofold. As you mentioned, it kind of gives us a opportunity to practice something we may need in the future. So I take it this would be at the Clough School?
No,
or
this
at Misco?
Misco.
Okay. So yeah, I would say, in my first opinion, would be to work with maybe Jamie on kind of an outline before we reach out to others, just so that we can give them something after Board of Health kind of reviews it. We could present those people that we want or we feel need to be notified some sort of presentation to look over. And obviously working with Jamie, we should be able to come up with a good outline to present to all those that need to be involved and need to be notified. Tom, what's your opinion?
So just kind of a pre-question, what do we normally average annually when we do our flu clinics? Any rough guess, Missy?
I'd say about between the one that's down at the senior center and the one here, I'd probably say a total of maybe 75.
Okay. Well, I like the concept of having a drive-through option, available and, looked at and assessed. We don't know when do we typically do these, does the month of October sound correct?
Yeah.
Okay. So of course, it's only July. We kind of trying to look ahead to it with a crystal ball to figure out what the fall is going to be like. We don't know. So it's probably a good idea to plan for it. And potentially too, it might draw some more folks. And I think it could, alleviate concerns should this, coronavirus situation still be fairly active, that people can comfortably come to an environment and be isolated, so to speak, from others and minimize contact, to get a flu shot. And like I say, I think it could potentially increase the numbers, which is always a good thing too. I like to see more people participate in it myself, so I'd be for it.
Tom, I think you'd be right in thinking about the increased coming to a flu clinic, especially if people, especially the elderly, or those who have a compromised immune system, that they can still go and get their flu shot without having to go into a doctor's office. They can stay safely in the confines of their own vehicle and not feel like, oh, I got to go into the doctor's office or I got to go into a CVS. It might, help them out this time. I agree with that. Increased numbers.
I also agree, and I have a feeling that where there's been some talk of the flu and maybe a slight resurgence in COVID coming this fall, that we may find more people interested in the flu vaccine than normal. And this would be a great way for them to be able to, as Missy said, safely get at least that taken care of. So I have a feeling, and I'm hoping that if COVID comes back in the fall, I'm hoping I'm accurate in saying a slight uptick. But I have a feeling more people are going to become conscious of, if they haven't in the past, getting the flu vaccine this year. Tom, Missy?
I think, those points, I think we're all on point with the thought about the drive-through aspect. Like you say, Missy, I think it's just a matter of maybe starting some coordination to kind of get a design together, if you will, on what it needs to look like and how we need to prep, differently for a drive-through version versus a walk-in version. So, yeah.
I agree, especially depending, like I said, if we are going to be playing any part in a vaccine, this will give us the opportunity to kind of play it out first, and we can still do 2 flu clinics if we feel that that's what's necessary, because typically we do have 2 flu clinics. We'll have one during the day at the senior center, one in the early evening here in the office. Again, depending on how the schools play out, whether or not they're open or not, maybe we could do one during the day and then and kind of keep that schedule going, and then do one in the evening. Again, it would be all part of how you guys want to handle it and what Jamie thinks and Ann. So that's just my 2 cents.
I would also be, obviously once we get some kind of an outline, Amy down at the senior center may have some valid input, and I don't know. I mean, October is the beginning of October can still sometimes be summer-like. So hopefully the weather will be on our side. But is there a possibility of doing it on a weekend day and just extending the hours a little bit to maybe catch people at an opportune time?
I think that would really depend on Ann, and what her nursing staff. I'm not sure if they do them on the weekends. We've never scheduled them on weekends, so I would be fine with that if you guys were fine with that, and if Ann thought it was was a good idea.
Yeah, I'm just kind of thinking if it was done, Saturday after lunch time, maybe, in the early afternoon, maybe we could catch everybody. I don't know, but I guess probably the first thing to do would be to, have this conversation with Jamie Terry, and, see what she has experienced in the past, or what she's heard, or what her thoughts are. And, we got time to build on that.
Yep.
All right. So, Tom, we're going to give Missy the okay to move forward.
Absolutely.
Thank you, Missy.
No problem. The next thing on your agenda is the scholarships. So the last meeting, you guys asked me to reach out to find out whether or not you guys could use your stipends for the scholarships. And when I emailed Eric, he said the only way you could do that is if you guys took your stipends, you filled out all the paperwork, you were paid for it, and then you would have to then write a check from your personal account for the scholarship fund. That's the only way it could be done. The way the budget's voted, it's voted for stipends. It's not voted for as a scholarship.
Okay, Missy, yeah, I got that information from you, and thank you for forwarding it. Personally, that sounds way too complicated. AJ has warned me about the paperwork that's involved. So I'm going to take it at that. So we really, that's our only other funding source.
Correct.
Tom, what's your opinion?
Well, based on what I understand with the process of quote unquote, I guess officially claiming the stipend, it seems like it may not be the most desirable avenue to take. Although I'm all for, I'd love to see that go to that purpose. I think it's a great purpose of assets, of money. I know when we last were meeting, we talked about a couple other possibilities. Not sure if we had any result on them. One was to see if our Hall or E.L. Harvey would support an additional $500 for a third scholarship. And the other discussion centered around connecting with Eric to see if our own BOH budget itself could cover an additional or a third $500 amount, as we are, currently looking at three candidates here to award scholarships to, as opposed to two, which is typically covered by E.L. Harvey's contract with us. Go ahead, Missy.
As far as hearing back from Mike, I have not. Mike's been kind of not around. I've emailed him about the dumpster for the hazardous waste day. I haven't heard anything. I emailed him about the scholarships. I believe I emailed him about the donation for the household hazardous waste day, and I haven't heard back. So I might just email Lauren Harvey directly and see if I have a better chance of getting a response back. As far as your budget, you would have to ask for a designated scholarship line item, and it would have to be voted on by the townspeople, that line item. That's how that would work. Do you have money? Absolutely. Do you have $500 to move around? You'd have to have another line item and have it voted on by the townspeople. And the earliest that could happen is November at a special town meeting.
And if we did that, would we have to declare a specific amount, or could an amount be quote unquote budgeted? Because we don't always know, I guess, what the quantity of scholarship requests that we get. The only reason we're having this discussion is because, normally we typically advertise 2 scholarships, but just so happens this time we had a third, and I think we were kind of in agreement that all candidates are worthy. And in the past, we had kind of set a little precedent by being able to kind of support an additional award. But I was curious how the specifics of that budget allocation would work.
You would have to specifically have a dollar amount, because a dollar amount would have to be voted on. And I don't know, I mean, I know the selectmen have a scholarship, and that funding source comes from the power plant. I don't know of any scholarships that are offered through the town that are funded by user fees or taxes or fees of some sort. Normally, and I can be wrong because I don't know I just know the selectmen's and I just know of ours. Normally those are donations from outside entities like the power plant and like Harvey. I don't know if the senior center has one. You know what I'm saying? The elders or the Taft Library. So I can look more into that if you'd like.
I'm wondering with the new knowledge that we just received with regard to our new revolving account, if this could play into helping to support this in any way.
Unfortunately, those fees, that revolving account can only, from what I've been told, can only cover the services rendered from the engineering, whether it's a perk test or a septic inspections. It can't be used for anything else. That's the point.
You're a party pooper.
I'm trying.
I would say at this point that if our trash hauler had the ability to be generous and fund a third one this year, that is probably the easiest route to go. And if they can't, I perfectly understand. And we'll have to make a decision. I know that one of the applicants is definitely going to be studying environmental science. In the past, that was kind of where the trash haulers were hoping that, you know, they would kind of give priority towards someone going into the environmental science field, which is understood. And we just haven't had anybody, you know, going into those studies like we do this time. So we not only have 3 good candidates, we have one that is definitely going to study environmental science. So it is a difficult decision. But I would say at this time, if they had the ability to fund a third, that would be great. If they don't, I think we're going to have to make the hard decision.
All right, so if you guys are in agreement, then I will email Lauren Harvey tomorrow and ask her if she could pass it on to the powers that be to see if we could get another donation, if that's okay with you too.
Yes. Yes, I would agree. If that could work out, that'd be wonderful. It'd be much appreciated. You know, I just kind of stressed that in the email that just the situation and that we have 3 really good candidates and just looking to see, you know, not expecting anything, but looking to see if there's a possibility they could help, and anything they could do would be greatly appreciated.
Okay, I will do that tomorrow morning.
Great, thank you.
Okay, so the next thing would be more of like old business, new business, or anything like that. The one thing I'd like to bring up is thank you, Tom, this morning for the statements that you made. I thought they were great. So this morning, Alan, Tom, and I took part in a kind of a regional meeting about mosquito control. They're going to send us a copy of the PowerPoint presentation and a recording and everything. And I thought that it was done very well. It wasn't just people who were pro the spraying, and it just wasn't people who were anti-spraying. I think it was a good mix. So I would ask Tom if, you know, what he thought and to add any comments.
Well, I thought it was well put together. I agree with you. I think it was a good representation from both sides. I thought it was a good open discussion. Very good viewpoints on the pro aspect of spraying where it could be beneficial, and I also thought there were very good pro discussion on, you know, trying to find other options other than looking at a pesticide type of a product to help control this mosquito problem. So I thought it was a good mix, and I hope that, something will come of it. I like the concept of a collaborative approach. So hopefully that can kind of come together well. And one thing I didn't mention myself, and I think is a good idea to include, is I think if we do a collaborative approach, I'd like to have it include, if possible, at the state level along with the local, and to I think incorporate a couple of specific variables within the community, and that would be conservation is a key element, along with certain citizenry, like in our case, Ann Mazar, who's great, has done a great job with this issue and getting the word out. So individuals like that, and individual citizens who can speak to the aspect of what they do from an agricultural perspective, whether it be beekeeping or the farming element, those that raise horses, things of that nature.
Yeah, I agree with you totally, Tom. I think that it's to have a real good look at it. I think it's more than just a Board of Health collaborative. I think we should definitely have Concom involved. Anne is involved with the land use and Metacomet, so she brings a lot, I think, to the table as far as that piece of it. We do have, whether they do it for hobby or for business, the beekeepers. We have Southwick Zoo, huge, animal population as far as, for Mendon and whatnot. When I did do the call with Andy Day, I think that's what his name was, Andy. One of the things I told him was that Mendon would most definitely be willing to participate in some kind of collaborative. I explained how we had worked with Upton for the H1N1, as we had a common goal, is we had school kids that needed to get the vaccine, and we worked very well with the town of Upton. So Mendon was is very willing to work with other towns. So he was glad to hear that. And I also explained to him the other things that other speakers brought up today. Is it was kind of funny, talking about people just looking on social media and, oh, there's a plane and this and that, how so many people are intent on watching the aerial spray going on. And how people were looking at their yards afterwards and saying that I hadn't seen this, I haven't seen that. And that's all stuff that we tried to bring back to the state, what worked, what didn't work. So I think even if we have the collaborative as a larger piece, maybe we should start talking to Concom and other people to see, is there anything that they're concerned as far as mosquito control? And what would they like to see out of a program, and kind of get our ball rolling, so that maybe when the bigger one gets together, we've already kind of seen what Mendon needs. I don't know. How does that sound to you?
Yeah, I'm on board with that.
Yeah. Did you
Go
want
ahead,
to
Tom.
tell? I was just going to say, I am too. And Missy, did you want to tell Alan what we told the folks on the phone?
What did we tell the folks on the phone? I don't remember.
That Alan would be glad to be our official representative.
Right. I did. I do remember that. Yes. And if he wasn't, that our valuable chairman, Mr. Fisk, would be able to too.
You see, we're there for you guys.
It's always good to know you have my back. Well, we're very fortunate where we've already done a little bit of this, working with Max and working with Ann and some of her friends. and putting out, a couple of notices. And it's funny when you talk about this. I remember reading one of Ann's connections had, responded in a group email that somewhere during the year last year, and this gentleman must like to be out in the woods hiking and everything, it got so bad he just stopped going in the woods. So we all have different ways of dealing with the mosquitoes and everything they bring along with them. But obviously this gentleman, it got to the point where the only way to avoid them was to stay out of their habitat, whether he liked it or not. So I kind of chuckle when I read that. I haven't heard too much as far as mosquitoes being trapped lately with Tripoli or West Nile, which is good. But we know it's coming. And I agree. Unfortunately, a lot of people, when they hear about mosquito control, they automatically think about spraying. So I think that that notice that Ann put out, and the few adjustments made to it to bring the horses into it and how it can affect them, we're sort of ahead of the game, and already have done some of the work that needs to be done. And Tom and Missy, thank you for attending this program today.
That was great.
Go ahead,
It was a
Tom.
great program. Well done. You're very welcome.
Yeah, I was very pleased with it. I think they had Dr. Katie Brown from Mass DPH. They had a gentleman from, I think it was out in the Berkshires, their mosquito control program type operator. They had people from Mass Audubon. So it really was, and some people who were on conservation commissions in Westboro, and one town, I don't remember her saying what the town was, but she was out by Amherst. So it was definitely a good mix of people, definitely gave you a little bit of room to think. And like you're right, as soon as people hear a mosquito control program, they automatically think of the trucks with the spraying, and it's much more than that. And if we can possibly get more of a la carte type of picture, I think the more of the education and the trapping, the surveillance, and as a start. So I thought it was great. Alan?
Well, again, both of you, thank you very much. And I would say that, let's, again, continue to move forward on this issue. I know that, Ann is away right now, but she's available by email. So, let's continue to move forward, and I will do whatever I can to be part of it. Thank you.
So, Alan, that's, from what I can remember and everything, that's all I have for you guys. If you guys have anything for me, go for it.
I have a few things. How about you, Tom?
I may have a couple.
You want to go first?
Okay, let's see. Something that had come up in discussion, it actually does go back to the coronavirus topic, but with regard, I don't know if you know this, Missy, with regard to the Southwick Zoo, I had heard that based on a guideline with regard to them opening up to the public, that people were not able to bring in any of their own food to the site.
That I don't know. I don't.
And I think that, I know in times past, people could bring food in because of what they do there. People could go and do a little picnic and whatnot. I just didn't know if you were aware of it, and if there was a reason, what would be the basis for the reason?
I am not aware of it, and I think there's a part of the guidance that came down for restaurants that the food had to be prepared on site, but I think that would have been more for catering type of situations, or I'm not really a food establishment, so I'll hire the pizza place in wherever. I haven't heard anything that you're not allowed to bring in your cooler or anything like that. I could look into it if you'd like, but I don't, off the top of my head, I haven't heard anything.
Yeah, if you're able, if maybe you could shoot out an email, it would probably be to Mike, would it be Mike Flanagan that would get it?
It might be Mike Coughlin with DPH, but actually it might be both of them, because Mike Flanagan is the Division of Labor and Labor Standards, if I remember that right. So he might have an answer, just because of it's a workplace. You know what I'm saying?
Yeah, I'm just curious if it's accurate, and if it is accurate, I'd just be curious what the basis is for that restriction on them. I guess I get, the restaurant aspect, a traditional restaurant, but this would be a zoo where normally, you have picnic tables, people could come in, it's just their family. I would just, like to get an idea of, what that's all about.
Sure. Yep, I can look into that.
Okay, thank you.
You're welcome. Anything else?
Well, the only other thing we haven't touched on, I don't know if we want to tonight without Andy, would be minutes. We had past minutes that we have to approve, but we can wait till the next go around if you want.
Yeah, because I just have to double check if there's one that, I don't know if it was Andy wasn't present or Alan wasn't present. And I don't remember off the top of my head which one that was. So we can, because I'm sending you more tomorrow for the month of June and then the month of July.
Yeah, okay, that's fine, yeah.
Okay.
No rush on it. Yep. And I think I had one other thing, but Alan, I'll let you go, as I'm trying to remember what it was.
All right. I wanted to know how the pink bag program was going. Not necessarily whether or not we've made a decision on letting them revise their contract. I'm just more interested in people getting service. I have seen the truck around. I have seen people with pink bags out. So, Missy, I'm curious as to if that is running smoother than it was when it restarted.
I think it might be. And again, I can only go by, I've never really gotten complaints or questions on the pink bag program. I've just really based it on, I know if one of you guys or Andy or a neighbor of yours or Andy's have had an issue, or if I've had an issue, I can say that last week I put out my bags on Tuesday night, and they were gone on Wednesday, which is my normal day. And they also had left bags for me tied to my mailbox, which I know that there was an issue with pickup and leaving behind bags. I do know I did see some chatter on the social media within the townspeople, and townspeople, letting people know that this is how you could get bags and whatnot. So right now, I'd say it's starting to go back, getting back on track, because I haven't had a large pouring of complaints.
Okay, good. And I'm seeing similar. So I just kind of wanted to confirm that. The other question is, how are we doing on tonnage? If I remember correctly, last time we talked about tonnage, we were up, and we felt as though we understood probably why we were up over last year. I'm just wondering if what the trend is at present.
So the only difference I can tell you is, when we got the bill for the month of June, it was up. Um, I had to ask for additional money of, $4,500, which Kim was able to get approved by the selectmen. And I had put in for the CARES Act, if it was even allowed, $5,000 to get us through the, end of fiscal 2020, because we would have taken at least into effect all the way up until the middle of May what the, tonnage was. And, I don't know what FY21 will bring us, but there was definitely some more usage, and we were able to, Kim got the money, but I don't know if we can, when the CARES Act money, I don't know if they'll replace the town coffers with it or not. But it was up a little bit, which we had suspected why it was up a little bit. Alan?
Okay, any updates on Galliford's with their live entertainment? I was wondering how Betsy was dealing with that, if we got any feedback at all from her.
I haven't, but that the last meeting that we had in June, when that topic was discussed, June 24th, I believe July 6th had started phase 3 of the reopening for part 1, where live entertainment was allowed. So now it would be allowed. It's not allowed indoors. So they would be okay as long as they had it outdoors, where they had it under the tent and whatnot. And one of the things they did bring up at one of the last EPH phone calls was a reminder that with drive-in movie theaters, either existing or that seems to be the new way some businesses have revamped their business, you still have to stay in your car. You still can't be outside of your car, on a blanket or in a chair or anything for a drive-in movie. You still have to stay in your car. And that was something that was specifically brought up by Michael Flanagan.
All right, very good. Yeah, so Galliford's may have kind of taken care of itself.
Yeah.
Just because of the timing of things, which is good.
Mhm.
Lenny and Tom, how they doing? Are they able to keep up? Are they feeling good? Is Tom recovering? What's the update on those guys?
As far as Tom, I haven't talked to since the beginning of last week. So I haven't heard anything from him as far as how he's doing. The last time I talked to him, he was doing okay. I know he was just waiting for a note from his doctor so he could go back to his regular full-time job. As far as Lenny, Lenny seems to be doing a lot better. He, I don't know, just having the time away on top of everything else, but he seems to be doing a lot better, trying to pace things better. And I've told him, if there's a point in time that you're overwhelmed or whatever, just let us know. We will figure it out. But I'd say as of right now, we're doing good.
All right, good. And the last question is Hazardous Waste Day. I believe you said August 1st is our date.
Yep.
Okay. I'm not sure. I know you sent out you wanted somebody's contact information for the Hazardous Waste Company.
Yep.
I didn't respond. I didn't
Andy
respond only. Oh,
Sorry.
did he? Okay, good.
So
That's
I have
fine.
a person and a phone number. I just needed one person, so if they needed to get in touch with somebody, I had a name and a number, and I will actually be contacting dispatch tomorrow morning to ask for an officer. And again, when I email Lauren about the scholarship money, I will be emailing her about the dumpster. It needs to be delivered next week, so we'll see where that goes.
Okay, I'm not sure whether I'll be able to attend this year. I'm really hoping I can, but as of right now, I can't say for certain. Tom, are you available that day?
Yes, I'll be available that day.
All right, good. Thank you. That's it for me. That's my little punch list. And I have to say today, Missy, when I was in the office, you're looking good. I'm hoping your hours are getting a little more back to normal and your routine is getting back to normal. Thank you so much for all you did to get us through those hard times. And if there's any way that we can take care of you, please let the board know.
Well, the good news is I am back in the office, which is great. Trying to give my family and myself some normalcy. As you guys may or may not know, my daughter is working for the Snack Shack this summer again down for the town beach and here in Mendon. So we're trying to get ourselves back into whatever our new norm is going to be. So that's great. I'd much rather be in the office than working from home, as I think I've told all of you guys. As far as an update, the town buildings are still closed to the public. They are easing the restrictions as far as board members or other committee members that don't necessarily have a full-time or part-time dedicated employee to start coming back into the buildings. The other day I met with Kim and Danny Gardner and another gentleman for furniture. They're actually going to be building us a small office in this building that we're in right now. They're going to reconfigure it, kind of give us a little bit more independent space. There are times that I have to have conversations with Lenny that really shouldn't be. It's a health issue, so there's really not. It's not needed for public ears, so to speak. So that will be interesting, and how that works. As far as I know of, we will continue to do the remote meetings. Once that changes, we will probably be going to the selectmen's meeting room next door, just because this one won't really be designed for a meeting room. I'm sure we could meet, the three of us with Ann and myself, maybe with Tom if he had to come in, because we don't have a lot of traffic. But if there was ever a time that we had a lot of people, we would definitely have to meet next door. So, I'll keep you guys posted on how that's going. The other thing too, I sent you an email, or forwarded an email to you guys tomorrow morning at 8 o'clock. I will be partaking in my first Zoom meeting with the school. I believe Trish will be available from Upton for our first kind of meeting with the reopening of the schools, what the plans will be like. Dr. Maruschek sent some information. They wanted numbers from me and Trish, which we gave them as far as how many positives, how many total tested, things like that. So I also explained that I am more than willing to attend these meetings, but whatever is asked, I will be bringing back to the board, or I will be bringing to Lenny or to Ann. I am not there to make decisions. I am there as kind of like a conduit between the school and the board, or Lenny or Ann. But if any of you guys, I will keep sending you guys the notices of when these meetings will happen. I will let you know, and I think, to me, the more the merrier. So I don't know how you guys feel about that. Alan? Tom?
I think it's great, and I'm really anxious to hear what they think they can do to try to get our school population back in line, or as close to what we had as possible. So I'm anxious, and if I have the opportunity to attend one of the calls, I definitely will, because I'm worried about our school population. They really didn't have much of a year, and I would hate to see that generation get behind and miss out on some very important things in those younger years. So that's definitely of interest to me, and I want to see them, succeed in whatever it is they feel they can do comfortably. So Missy, thank you for dialing in tomorrow and being that conduit so that we can assist them in any way possible. Tom?
Well, when I saw the start time, I thought to myself, geez, who picked 8 o'clock? I mean, I'm in the private sector. We don't start thinking till at least 9:15, I will take a shot at trying to attend that meeting as well. But I'm not going to make any promises. But I do appreciate you, Missy, jumping in and grabbing hold of it. And that's the way to approach it, if anything, just as an avenue, a conduit of information to kind of pass along and put it open for discussion, because there are a lot of different viewpoints within our group that I think, would be beneficial, and not all of us can make those particular types of meetings. So much appreciated. Yeah, so hopefully that I am anxious to hear. I know it's just getting going, and from what I understand, there's multiple groups that are involved with this process. It's going to be interesting to see what can come out of it in terms of options to successfully get the kids. And I don't want to say get them on track, because I don't know necessarily, not having conversed with the schools directly on it, how this past season went for them, how it wound up. But hopefully going into a brand new year to keep them on track with combinations of learning options that might be a little different than the normal. But just like Alan, I'd hate to see them, fall behind or get sacrificed in the learning process. But again, it is the health of the folks involved that we have to think about, and I understand the concerns.
Yep. I do know that they're looking at there are the 3 options. Totally going back in like nothing's ever happened, with some recommendations, the mask and the distancing and things like that. So it's not really like nothing ever happened. That was a poor choice of words. But going back in-house, then there's continuing the studying from home, and then there's a hybrid. I have a feeling that they're going to try and work a hybrid, which would be, I think, beneficial to everybody if it can be done the right way. I know there's concerns about busing, and especially the younger kids who will have to wear masks. I know there's concerns with children or even the high schoolers as far as the socialization part, those who are on IEPs. So there's just so much that's going to have to go into this to try. And I don't know if they can accommodate. They're definitely not going to be able to make everybody happy. But I think as long as the decisions are made at the best you can, just like I always tell you guys, you're here for public health, and you're here to do the job that you've been elected to the best way you can. Again, you're not going to make everybody happy, but it will definitely be interesting to see how this turns out, for sure. Alan?
Yes, I know from some firsthand experience, there are some people, some students that I've heard have a difficult time learning remotely, and they realize it, and they realize that they need to be in the classroom. On the other hand, my sister-in-law is a school teacher in Milford, I believe 7th grade science, and she had a hard time getting kids to log in, and probably for a multitude of reasons. Some didn't have the equipment, to log in. Some maybe didn't have the supervision to make sure that they logged in. So there were times that she was, running classes that she was supposed to be running, and you'd have 3 students jump in. So that's there's a lot of difficulties in getting everybody on the same page, no matter which program you decide to do.
Mm-hmm.
So it's a definite concern, and they got their hands full. Next meeting.
So if you guys are just typically you meet on the second and fourth Wednesday of the month. So that would leave you at the 12th and the 26th of August. If you want to do the every other week, you would meet again August 5th. So it's up to you guys, whatever you guys want to do.
Tom,
I'm
any
open.
preferences?
No preferences. If we can maintain the 2-week spread, but I'm open.
Yeah, I could go the 5th or the 12th.
So
Doesn't matter to me.
how about we go with August 5th, just so that if I do get in touch with Jamie, we can start working on plans sooner than later.
I'm in.
Yep, makes sense.
Alrighty.
And before we adjourn, I did recall my my follow-up questions that I forgot.
Please move forward, Tom.
The dickens, you say. One had to do with a residence that was going to be utilizing I guess what was an unlicensed, at the time anyway, an unlicensed vendor for dumpster. Missy, it was 93 Providence Road.
Yep.
Dave Claro, did that work out okay?
Yes. Yep. That's all
It did.
set. Yep.
Great, excellent. And one of the other ones was Galliford. Thank you, Alan, for bringing that up. It's good to know that. Sounds like with phase 3 in place, that's going to hopefully they now be able to do things that they couldn't do before. And the last thing I had was, do we know what the current situation is with 65 Hartford Ave West?
That one, they are getting ready to schedule the perk testing. I do know I've spoken to the property owner multiple times. I told him what was expected. He's not sure how he'll be able to do it all. I told, the only other option he has, if he can't or doesn't want to repair the septic system, is to board up the house. He's talking about selling the house, things like that. How much time will the board give him? And it is a failing system. It is a health issue. It has to be done. One of the questions he did ask was, if he decides to sell the house, how long will the board give him to sell it? And if there's nobody living in the house, it can take, and it's boarded up, it can take as long as it needs to. But as long as there are people living in the house, it's an issue. It has to be done.
Yeah, I agree.
Yeah,
I knew. Oops, sorry.
No, go ahead, Tom.
I was going to say agreed, and just in talking with one of the key residents there, last we spoke, it didn't sound like at the time they were in a position to necessarily be able to vacate. So I don't know that they'll be able to, unless you've heard something different with regard to those folks, if they'd be able to find an alternative living situation.
Yeah, the property, I mean, the renter has not reached out since everything first started happening when I was out. Um, I do know the property owner feels that now that the piping is unclogged, that why do I need to fix this? And I said, because your system is in failure. That's why it has to be fixed. And it's in failure where it's a public health issue. Um, so I don't know what direction this will go in. Um, but I told, the perk test is being scheduled. He's hired the engineer. The $300 has been paid. But where it will go from there, I don't know.
Did he acknowledge receipt of the letter that was posted on
Yes.
his door?
Yes.
Okay.
Yep. So
And, go ahead.
he is aware, and he knows that, you know, he feels because it's now unclogged, that it should be all set. And I'm like, no, it's still a failure. So he did come back and did pull the park application and whatnot. I did talk to Lenny because unfortunately, the gentleman owes back taxes on the property. Typically, I would not be allowed to have the perk testing done because of that, because we have a bylaw in town. But speaking with Lenny, we both agreed because this is a public health issue. So therefore, the testing is going to be done, whether the gentleman owes back taxes or not. So this is one of those times where, because of, health issues, we will supersede the town bylaw. And if someone doesn't think that's right, by all means, they can come and say something, but it's a public health issue. So um, there's no getting around that. It has to be done.
What is this bylaw that you're referencing? I'm not familiar with that.
There's a bylaw in town that states that anyone that has real estate taxes that are overdue a year or more, and my understanding now is the law has changed statewide that it can be a day late, that you can't get a permit, whether it's a building permit or a food permit from us, or a septic permit for, septic plans or whatever. But yeah, there is a bylaw on the books for that. And normally I do abide by it depending on what's going on. But with this one, because there is a public health issue, there are tenants involved, it has to be done regardless.
Oh, yeah, I would definitely think the public health issue supersedes this bylaw, and I would think anybody looking at the situation would reasonably conclude the same thing. We're looking to get a permit for the betterment, to improve the environment. It's not to necessarily his advantage.
Mhm.
It's really to make things a more healthier situation. And one last question on that property. Do we know if building had gotten involved with that property at all?
I have not heard anything that building got involved, but I don't also know if the person has called back or not. I can ask Gail tomorrow if you'd like.
Yeah, I'm just curious. I know that they were queried in the process, and I was just wondering if they ever got involved from their side.
Sure. I'll ask
Yeah.
them, and then I'll send you a quick text.
Yeah, okay, appreciate it.
No
I'm good
problem.
on my end. Thank you very much.
I guess I'll chime in that I'm encouraged that things are happening, positive things. It's just that, nobody really knows how far this gentleman is going to be able to go with it. But if he came in, he pulled the permit, he paid the money, he hired an engineer. That's definitely encouraging. Anything else, folks?
I'm good for my end.
All right. Can I have a motion?
I motion to adjourn the meeting.
All those in favor? Aye.
Aye.
Thank you very much. Much appreciated. And next meeting, August 5th.
Talk to y'all then. Good night.
Thank you all.
Thank
Good
you.
night.
Good night.